I've been involved with the mental health service since the age of 8. For a long time I thought all hope was lost. However, I lived successfully in the community. In my time in hospital, I have been on the receiving end of restraint many times and also witnessed a number of restraints of fellow peers. I have had some really bad experiences of restraints that I still find difficult to talk about today, but I can also look back on some of the situations where I was restrained and realise that it was done in the best possible way. When you are acutely unwell, your mental state is distorted, and when you are attempting to hurt yourself or other people, you may not understand the seriousness of your actions, as you feel totally out of control. In this situation, if 4 or more members of staff suddenly grab me and hold me down, I would think that they are trying to harm me or just doing it to show that they have power. This can be extremely distressing and encourage more anger and upset. I can now understand that this was not the case and that I was being restrained in the correct way. But things like this do happen. Most people are aware of the investigations into the Winterbourne View Hospital and how this abuse of power and restraint has negatively affected the lives of many patients. This was probably when the use of restraints was highlighted in the media, and therefore the aim to reduce restraints and restricted practice became a bigger priority. If restraints and restrictive practice is not monitored properly and steps are not taken to reduce the amount of restraints used and to make sure that is only used as a last resort, these sorts of things are more likely to happen again. Although I can look back and see that the restraint in my case was a necessary intervention, in most cases the person that needs restraining is not going to be someone who is of sound mental state and will be immensely distressing for them and in many cases feel like abuse. Having spoken to other service users who have experienced restraint, they have reiterated what I have said, but also said that it is painful, hurts physically, and you can be injured. On the contrary, I have also known patients who have said it can be comforting when talking about restraints, but this is not the purpose of restraints. It could also be detrimental to a patient's psychological well-being, as if they believe the only way to get that comfort is to have an incident. Instead of restraint, you could use de-escalation techniques to show this patient there are other ways that they can feel secure. These are some of the things that patients have said that have helped them not get to the point where they need to be restrained. Go to sleep, have a one-to-one with staff, and PRN mediation. I have always found that distraction techniques work for me. If I was becoming distressed, a member of staff would help me by playing cards or doing some arts and crafts, and that would, 9 times out of 10, prevent me having an incident. Unfortunately, there are times that distraction techniques wouldn't work, and I would have to be restrained, and these experiences still have an impact on me. Even though I know that it was for my best interests, these experiences were still traumatic, and I believe if you know your patients and you have a good relationship, restraints can be avoided most of the time, and there are better ways to help a person than to restrain them. The fact that Sign Up to Safety has taken the initiative to make reducing the use of restraints a goal within this national campaign is a fantastic opportunity to look at different ways to connect with patients in a way that doesn't hurt them or the staff. Remember, it only takes one person to talk to me, but it takes 4 to restrain me.